And think about your upper back kind of curving the other direction.
Okay.
Say a little prayer while you're down here for the world, for everybody.
Save the world.
There you go. Go ahead, Nicole, send it out there. Hey everybody, this is Dr. Warren here at Kelstein Chiropractic. I'm with Nicole. Nicole, you've been in the office for how long now?
7 months.
7 months. We're gonna do a little video for the people.
Sounds good.
We're gonna talk about Dowagers Hump. And a lot of people come into the office and one of their chief complaints is they get upper back discomfort. They get the rounding of the shoulders. They get tension or discomfort in the spine and in between the shoulder blades.
Sitting at a desk.
Sitting at the desk, sitting on the phone, sitting on the TV.
Driving.
Come on, a couple different areas where we get it, and we deal with it quite a bit from a standpoint of pain, but we also give and educate people on ways of dealing with it on their own, of managing it. So let's just back up. What is Dowagers Hump? What is this concept of this rounding of the shoulders? Let me explain it from an anatomical standpoint. Okay, so you've got 3 areas of the spine. You have your cervical spine, your thoracic spine, and your lumbar spine. The Dowagers Hump is mostly concerning the mid-back, even though the whole spine is going to be affected in essence, okay? Specifically the neck. And so for the cervical spine, when you have Dowagers Hump, it's going to be pushed forward a little bit more. You're going to lose this natural C curve, the secondary curve that you have in your neck that you develop, and you might see someone with their head forward and up a little bit more, okay? When you're in that position, it just naturally puts more stress there. Your body is, your head is being supported by this area of your neck more as opposed to by your whole frame, okay? And then specifically the hump itself, where people see in the mirror or feel the tension or discomfort, and sometimes when the body is abnormally stressed over time like this, it gets irritated, it gets overstressed, right? And so you'll see a T1 or T2, a thoracic vertebrae 1 or thoracic vertebrae 2 prominence. You'll see this kind of pointy spot that's kind of coming out a little bit more this way, okay? And what's happening around that spot is your shoulders are rolling forward and in, your pecs are tight, okay? And the rest of your upper back, like your upper traps, okay, are tight as well, all right? And so there's things that we do in the office relative to managing that. So when people are in pain, we might use dry needling. When people are in pain, we might use class 4 laser. Those are modalities of treating irritated tight tissue. For the stiff joints, we adjust people, that's for sure. We do soft tissue work and massage, manual therapy. So I'm going to show you how I adjust Nicole. And Nicole does not have a Dowagers Hump. She's got some discomfort in between her upper back. She just had a long day working here, helping patients out, doing all those modalities we were just talking about in the office, and a lot of positions like, say this. All right, so you know, it really kind of covers a lot of different professions, if you will, in terms of experiencing this discomfort, including a chiropractic assistant. Hey, you.
Hey.
All right, Nicole, so go ahead and sit there for me. I'm going to kind of show people what I feel for relative to palpating upper back discomfort like this, okay? So from a scan standpoint as well, from a movement standpoint in the joints, I'm going to motion palpate her thoracic spine. When I do get to Nicole on this, and I've been working on Nicole's back for the last couple weeks, and Nicole is a little tighter through this upper back area. She's little, but she's mighty, okay?
Damn.
She packs a punch in here. There's no doubt about it. And so this is an area and spot that we've been, I've actually been dry needling on her because she gets a little irritated up top here, and doing some soft tissue work on her as well. And we can kind of show you some of that right now, okay? So at the end of this video though, I want to show you, bring your head back, Nicole, and bring your chin down to your chest. 3 really good stretches that you can do on your own. And it's not just stretches for the muscle, it's movement for the joints too, okay? And if you incorporate this into your routine on a regular basis, or you use it in conjunction with like an active program, an exercise program, it should relieve some of that stress and tension on the spine, okay? I'll digress into something that I think gets lost and utilized, and it's more probably of a unfortunately, a little bit of a fear tactic in the medical community relative to imaging of this type of a problem, right? We get these images, and sometimes we're in pain too, so that will throw off the presentation of our spine. I call it antalgic positioning of the spine. But the anatomy might change over time, right? And we might see some of those changes occur over time on an image. And that doesn't dictate function, though. So what dictates function or movement problems like stiffness and pressure and tension and pain in the upper back is movement, right? And so you have a movement-based problem more often with this. You need a movement-based solution. Head back for me, Nicole. And when I see someone say they've got some arthritis in their upper back, you can head down for me. Say there's a little bit of disc narrowing, right? So those cushions in the spine are a little less, right? Or decreased in size. And in extreme cases of a Dowagers hump, you might see some changes in the vertebral bodies a little bit over time as well, right? You might see them kind of shift in terms of the anterior portion, get a little bit more wedged, is what we call it, right? Those are more extreme cases. And most of the time when people come in and say they have this, they don't have those extreme things going on. So just keep that in mind. So I say all that on the image. Head back for me. Chest up. Head back again. There you go. And that was a good example of how her chest body position just changed her neck function. Do that again. Go. Bad posture. Worse than that. Come on. There we go. Good. Now bring your head back. Do you feel limited?
Yeah.
Okay, now go forward. Sit up. Bring your head back.
Oh, yeah. That's way more.
Okay. So if you've got better control, better positioning, your neck is kind of in the space it's supposed to be in, and it will act like it's supposed to act a little bit more, right? Let's do that again with the shoulder. Okay, here's an easy example. I tell people this is why posture is important. And you control your posture. If you're really tight and irritated, I help people get untight and less irritated. And then, that was very clinical the way I described that one. That's all right though. And then go ahead and slouch for me again. A great slouch. Okay, don't practice that too much, Nicole. Let's see your shoulder now, okay? Come over here for me. Straighten the elbow. Raise your hand over your head. Oh, I know you can do it better than that. Okay, that was a little forced, but okay. She had to kind of go one of these to get that up there. Now, give you the nice posture that you hold naturally. Right there, good. The posture where you can kind of relax but be up, not be like this, okay?
Got it.
Yeah, you got it. Now, go ahead and show me the shoulder movement. Easier or harder?
Way easier.
Okay, so all I did, truly, is I took her mid and upper back from flexed to a neutral position, if you will, a more controlled position upright, and her scapula shifts a certain way so that her shoulder moves more effectively. So your posture dictates your function. So it is important to have control with these things. This is definitely important. Okay? So you can change your function, you can change your control. Sorry, I'll get back to your shoulders. What am I doing?
Touch me.
Talking, work, come on. There you go, bring your head back for me. And then head down for me. My wife just says, get to work. She doesn't even let me talk. So this is a nice opportunity where I have a balance. You gotta bring your head back for me. There you go, head down, nice and easy. You know, the function of those areas, sometimes you see this picture and you're like, oh my God, look how bad my posture is. Well, there's no changing for the most part what shows up on an image. Okay, and that's a hard pill to swallow sometimes when you see some things. But you need to have that reality check, if you will, for the most part, as it relates to, let's just say, some of the changes that occur over time, like arthritis or narrowing of that disc, or some stress response due to, say, what we do for a living, like what I do for a living. But the reality check allows me to focus on what's important and what I can control. Okay? Bring your head back for me. You feel me, Nicole? Mm-hmm. Am I connecting to you?
You are.
Perfect.
We're connected.
Bring your chin down to your chest for me. Good. All right, so with Nicole, we're doing pin and stretch, some ART. When I go to adjust her, it's going to move so much easier, and I need a little bit of help with Nicole. Even though I adjust people all day long, Nicole back, it's kind of a little mighty in there. It's strong. It
gives him a run for his money.
A little bit. A little bit. Head back for me. You go, lift your chest up. There you go. Good. Head back again. Other way. Other back. There you go. Head down for me. Good.
Oh, yeah, that one.
Yeah. That right side. It's got a little bit more.
That's my pitching arm.
It's your pitching arm.
Yeah, I pitched with that thing for years.
Right on.
It's
Reach
bad.
across. Do you still play?
I do not. I should.
You should.
I really would rather play volleyball than softball. Volleyball was my sport.
Baltimore's got some good sports organizations down the city, but they've got all kinds of stuff out here too. Shout out to Volo. All right, so this turned into an educational video from to a treat Nicole video.
Yeah, I like it.
So we'll get back to the education in just 1 second. Reach for me.
Oh.
Glad you got the laugh out of that, Carly.
Good weight hand, flop it around.
At least I got my nails done. You had to look.
You did.
I did.
You look good. Go
Thanks.
stand up for me. I did my daughter's nails last week.
So cute.
So surprised.
And she listens to my wife. She listens to me. I'm like, all right, now scroll it, sit still. And she's like, what? Like, nothing. Like, I'm like, all right, I'm not doing this anymore.
That's awesome.
There's paint everywhere. All right, so you can, I'm going to show, you can lie. Follow me, actually.
Ooh.
Sir, do you mind if I use this table?
Not at all.
All right, awesome. Appreciate it. No, you're fine. You're fine. All right, Nicole, you're going to sit here with your feet up there.
Okay.
Good. And then you're going to interlace your fingers like this. Rest your hands. Sorry.
I know. Is it my clip?
I just don't want you to push your fingers on. Go ahead and take your hands right on top there. Good. I'll bring you back. Bring your elbows together. And then come down. Come back here. Open up. Now relax your shoulders a little bit. I'm going to grab onto your sides, okay? There you go. Good. You're ready to go home, aren't you? Mm-hmm. You still clocked in right now?
No, maybe. I'm doing a video.
Take a deep breath in. I'm just messing. Easy exhale, let it go. Good. A little bit more.
Oh,
Perfect.
yeah, that's it.
Sweet. Swing your legs to your left. All right. And because there's more to move on her, you're going to come on your stomach for me. There you go. Stomach. And you can relax on him. So just a upper back extension adjustment. We showed you how a lot of times that tension brings us here. This is going to allow her to move through these stretches a little easier, and she's not going to hurt as much up here. Scooch up a little bit for me. There you go. Take a deep breath. Easy exhale, let it go. Good. Good. Deep breath. Easy exhale, let it go. Good. Now lift your chin. Rest your chin. Good. Good. There we go. Okay. There you go. Scoot forward. I just have to keep telling myself, Nicole, never give up. Just keep working it. She starts to move really nicely on those adjustments. You know what I'm saying, Nicole? Mm-hmm. Okay. You're going to feel a little movement right there, okay? Mm-hmm. So this is T1, T2. This is how I adjust those areas, okay? I'm going to put extension, rotation, and lateral flexion into the joint. And she's nice and relaxed. You're going to give me another inch my way if you don't mind. That's perfect. Good. So you can watch me. Extension, lateral flexion, rotation. It happens quick. Just like that. And a little lower. Okay, T1 prominence, T2, edge, rib. I'm going to move her rib on this one just because I feel that restriction there. Okay. So I have to align a little lower. My elbow is a little bit more in line with that as well. And it's such a deep spot. I had to kind of get respect from her body to move her in the sense that if I just went in and pushed, she's going to guard. So I had to kind of finesse it. There's the finesse. Mm-hmm. You feel it kind of moves before I even get going?
Yeah, I like that.
Yeah. Okay. All right. So we did some ART, some soft tissue work. ART is just the name for it. ART providers are awesome. In my opinion, in terms of just their ability to kind of work soft tissue, massage, PT, chiro, they get trained in that program. If you ever need a good provider that does soft tissue work, I had to release technique. And then I did adjustments in her upper back, 2 different ways, out there and here. I adjusted her upper thoracic spine with those sideways adjustments that you just saw at the end. Cool? Mm-hmm. Ready to show the people how to do the stretches?
Sure, you want to adjust my low back too?
Yeah, sure.
You're the best. Yeah, that's the side that's killing me, the right side.
Yeah. Okay, do this for me. Lie on your side, this side up for me. I watched the Lego movie with, gosh. Did he sing that song, Kick Push? Happy?
Pharrell Williams.
Pharrell Williams?
Yeah.
It was so good.
Wasn't it?
It was good. Did you see it?
I saw parts of it
Yeah.
because my friend's sister was watching it, and I was like, oh man, that looks good.
I was like, I'm about to watch a whole Lego movie right now. And
I want to watch the Lego
like,
Scooby movie.
Still kind of feels weird on watching a Lego movie, but it's actually kind of cool that he did it this way. And it was so well done. And I had so much more respect for Pharrell Williams.
Right.
There you go. So, I got you. Just a little release. Good. Come on your back for me. Lie on your side, this side, facing this way. You need a little bit of work on this hip over here and low back.
Yeah, I've
Some soft
had it
tissue
needled
work.
with Nick last week.
Did you?
Yeah, he did both sides.
Did it help?
Yeah, but afterwards, I noticed the knot a lot more. Like, I didn't notice it moving when I walked before, then he needled me, and now I notice it when I walk.
Yeah, it might just kind of be highlighting a little bit for whatever
Yeah.
reason. I want to give you some stuff to do outside of here, like some stretches.
Okay.
And some mobility work around this hip. I think it'll take some tension off the way you load these joints here.
Yeah.
Okay? But we can look at you like from an exam standpoint a little bit more.
Cool.
And see how you balance when you lunge and you squat. On this side. See, this side moves just fine.
Oh.
That's easy.
Yeah, see, it was the other side. Yeah, I felt the difference.
Let me do this for you. Okay, we're digressing to her hip. That's just a little tight.
Yeah. It's because, did I tell you I was born with my hips dislocated?
This one was.
Both of them were dislocated when I was born.
You had hip dysplasia as a kid.
Yeah. Like I came out and they were.
Did they put you in a brace for a
Yeah,
while?
I have the brace still.
Do you?
I do.
Pretty
It's in my
wild looking.
attic.
Yeah, my
cool.
niece had that.
Yeah, it was crazy.
Got a little traction.
Oh yeah.
Okay, grab my hand. Sit up with me. Good. Swing your legs this way. All right, so 3 stretches for Dowagers Hump, okay? Come face me. Sorry to put you on your knees at the end of the long day. All right, so we're gonna get on a chair. We're gonna get on like a ottoman or even into the couch. This is a really simple way to put some extension, similar to the adjustment that I did, into our upper back and move it in that way. We're gonna floss the joints back and forth. We're not gonna sit there and statically just hang out, because joints don't like that. They like to move, okay? And so this is gonna be a repetitive routine that we do 10 times, okay? And then we're gonna break it down, do it slow. So watch, prayer. Go ahead, elbows up. Good. Hips go back a little. Good. Go ahead and look up. Good. Now drop your chest to the floor. That was really good. You kind of shot back on me. Okay. Try to think about keeping your head up. Head up. Good. Now drop your chest down from there. There you go. Good.
Okay.
Do you feel your upper back is getting stretched? Now take a breath through your nose. Exhale through your mouth and sink. Don't let your elbows come off though. Because it's going to become more of a shoulder if you do that. There you go. Good.
Yeah, I feel that.
Like a lat stretch as opposed to an upper back movement. Okay, come back and restart it. So it's going to look a little like this. Let me just go through one. Drop down, head up, sink. I might even get a little release when I do it, a little adjustment. Okay?
Yeah.
So try to keep your body from going down and in. And think about your upper back kind of curving the other direction.
Okay.
Say a little prayer while you're down here for the world. For everybody.
Save the world.
There you go. Go ahead, Nicole. Send it out there. Okay?
Peace, love, and happiness.
There we go. Come back up. Oh, yeah, Horn. Peace, love, and happiness for all. Hey, we right here from Baltimore. We're going to save it, baby. Here you go. Head up. Good. Drop. All right. So I'm telling you, this is one of the more powerful, especially if someone's like, my rib is killing me. It really does help it with pain, but it helps with function too. It helps move your upper back and stretch you the right direction. And when you go to lift, when you go to work, when you create that stability on your own, you're gonna be in a better position to do it as opposed to being like going in the gym like this and getting strong. Okay? Or whatever you like to do. So there's your upper back stretch, okay? I got 1, 2, to the chair. All right, how do we get to that rib adjustment that I showed you where I moved her head? And I'm gonna show you how to do that on your own, okay? Just to gently stretch those joints and move her neck. So we're gonna go through Mackenzie threes. Here you go, sit here. And Mackenzie's just the name of a group of stretches. Movement patterns for joints, sit all the way back for me. Actually, you can go up like that, that's cool. And then, Carly, do me a favor, come on over here. So we're gonna go chin retraction. Don't go so far down, go straight back like you're avoiding somebody. Then go back into extension. Keep going. Relax your shoulders though. Okay, don't be like this when you do this one or it'll just feel hard. Let your chin go lead the direction. Yeah, there you go, good. Now in this position, you're gonna turn left. Good. And you're gonna turn right. Wonderful, good. Come back and go back farther. Good, and then relax, okay? So, let me show you through it again, okay? Chin retraction, nice and light. Extension, keep going, keep going. This is a very helpful tip. Lift your chest up for me. Perfect, now turn left. You feel it got a little deeper? Turn to your right. And what I mean by deeper, I mean where my finger is pointing back here. And then come back, and let your head go farther back. Good, and then come off of it. Good. Do you have to sneeze?
I have to go.
You have to cough? Carly, take a... And then edit.
Cut.
Resume.
Oh no, I think that was pretty real. It's
That was
okay.
pretty good.
Go ahead and remember, don't let your shoulders go here. Be there. Here you go. Good.
Wow,
Just
I'm
in
like,
control.
I just do that, don't I?
Everyone does it a little bit. It's okay. We just have to try to find that element of control because we just do a lot of this. Anyways,
So true.
Jim, here, head back. Go, 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 go. Good. Pause. Relax. Good. Turn left. Beautiful. Turn right. Wonderful. And come back again. Let the lady call.
I'm recovering from being sick.
I won't be in the office tomorrow, okay? So Carly just got us, but no, I'm just kidding. All right, cool. So go ahead and stand up for me. 10 times, right? And you can work with that. Listen to your body. If it's too much, obviously, be mindful of those things. So, but I would do these 20 times before a workout. I would do these 20 times before a workout, or when I'm feeling like I'm kind of going that direction. And you can add it to your daily routine if you're that committed. Good for you. It's not my show. It's Nicole's show.
Is it?
It is.
All right.
All right. I mean, you want to adjust me? That
I mean,
turns into my
Do
show.
you want me to adjust you is the question. New doctor.
Oh, soon. Angie.
Facts.
Facts. Okay, let's see it. Put your hands up there. Nice, good. All right, now show me how it's done. Nice, easy. So thoracic extension, cervical spine extension with rotation. Now we're doing more purely thoracic rotation. We're gonna relax that shoulder down. There you go.
It wasn't me.
It wasn't you.
You can't cough and they say it wasn't me. That was good.
We're gonna
Okay.
get you some water in there, Carly. I got you. Just
Do we
leaving
need
her
an
hanging
assistant?
there.
Do we need an assistant to get you some water?
Hands up. So thoracic rotation, T-spine rotation drills. These are so good. Stay upright in your spine. Don't lean forward there. There you go. There, right. Stay over that hip, if you will. Okay, that makes a difference. And then come back. Eyes will follow. Body will follow the eyes, if you will. Perfect. Good. Try to pin that there. Push that against there. So I'm gonna have her drive her knee against the wall. And then come back. Just move it to where you can get to. Each time it's going to go a little bit farther, which is an awesome thing because you're getting better motor control with the pattern of movement. Good. Don't let your torso tilt that way. I'm going to drive you up a little bit. There you go. Good. Relax your shoulders down. Make it smooth. Be like a...
Okay.
Like
Black
a
swan.
Like a swan. I like that.
Go ahead. Good. Last one. Good. So she's pushing her knee into the wall. She's focusing on her mid-back, doing the rotation. She's opening up. And then I'm going to give her a little bit of a tip here. Go ahead and go back again. Good. Pause. Try to reach towards the spine. Ah, beautiful.
Ooh, yeah.
Now go to the wall.
Whoa.
A little extra on the torso. All right, so she'll do 10 each way, okay? 3 stretches. 20 reps total each. 60 reps all together. Did we do that right? Yep. And then... when you get that done, probably about 3 to 5 minutes, 5 minutes, let's be real, That's not a bad little routine to take some stress off your upper back. And if you keep working on it, it really will improve your function, okay? So don't be scared of the x-ray or the MRI in those areas. Focus on what you can control, which is your movement and your strength, okay? And these are 3 simple ways to take power of the ability to move in your upper back and neck and to decrease some of just the day-to-day grind that we all got to do.
Yep. We all do it.
Most of us do it. Thanks for watching.